You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with peripheral neuropathy. My first guest is Dr. Ott. Dr. Ott, welcome to the program.
Thanks so much.
Now, before we get into today's topic, and we've had you on the program, for people that don't know about your center, tell me a little bit about it. Who's the typical patient, and what are the different things you treat?
Integrative Health of Orlando is just that, an integrative setting. We work with a team of physicians from all different backgrounds, as well as allied professionals in really a team approach to dealing with three primary categories of patients: diabetics, hypothyroidism or low thyroid, and peripheral neuropathy, which is what we're talking about today.
All right. Okay, so this peripheral neuropathy, define it. What is it, and how big of a problem is it?
Peripheral neuropathy is essentially when patients have altered sensation or a loss of sensation in the arms or legs, hands and feet, and can also demonstrate itself as motor loss, so an inability to actually move some of the body parts, and it's a huge problem, especially for the person suffering. So there's a pain
component to it, like burning, tingling?
Yes. Pins and needles, all of those things. There's really a progression that happens for patients. So pins and needles, generally the first symptom that shows up, then numbness, then burning.
And it's the very tips. I mean, what, the very tips of the fingers?
Not necessarily just the tips.
Okay.
I mean, it can be the whole foot, for example, the entire bottom of a person's foot or the entire top of a person's foot. We have patients that have peripheral neuropathy that shows up down the front of their leg, for example. So the shin area. You know, these are people who have problems to the extent where they can't put a blanket over their feet or legs at night because it feels like their feet or legs are on fire.
Is that right? Would you say there's tens of millions of people that have this?
I don't know what the exact number is. I don't know if it's tens of millions, but it's certainly a very, very large number. There's so many different possible causative factors that can bring it on for a patient that, you know, it's one of these things that we're seeing rise. So, diabetes, a big one, for example.
So in the category of peripheral neuropathy, do you consider things like sciatica falls in there too?
Yes, absolutely.
Okay.
Yeah. So sciatica is one of them, and you know that's probably the one that people are most familiar with. But there are diabetic neuropathies as well that people that are suffering with diabetes are very familiar with if they're living with those.
So your diabetes patients are perfect candidates oftentimes for this program?
Yeah, many of them come in with that symptom in their list. Some of them do not, but many of them do.
Which is what? What are their symptoms? Just numbness?
Sometimes it's numbness, sometimes it's burning, sometimes it's just constant pain. Sometimes it feels like, some of them will describe, for example, that like they feel like spiders are crawling on their skin.
Okay.
So it can be any number of those.
Are you seeing reversals? Because I mean, you have a pretty comprehensive approach.
Yes.
And, you know, I did my best to try to understand it. I looked at your website, we talked on the telephone, and a pretty sophisticated way you're handling this.
Yeah, patients are getting better on a regular basis. We're seeing patients who come in with pain numbers that they would rate as 7, 8s, 9s on a scale of 1 to 10, who are getting down to 4, 5s, and even down to 1s and 0s in many, many cases very quickly. Discoloration of the skin is another real common problem with peripheral neuropathy. Generally, these neuropathies come on as a result of attack on the vasculature. So
is it a nerve problem? Is that what's going on?
Yes, and it can also be a vascular problem that's causing an eventual nerve problem. So it can come on from a number of directly an attack on the nerve itself, for example, post-chemotherapy.
Okay.
Chemotherapeutic agents have an affinity for nerve cells, and so those cells can be damaged directly by those agents, for example, or like Agent Orange, and you know we've heard of that from back in the war days.
Yeah.
So those kinds of things can be direct.
And they would be candidates for this program as well?
Yes, absolutely.
Okay.
But there is also the person who has vasculature issues. For example, the diabetic who has now damaged blood vessels in the lower extremity. Those are the ones we generally see that discoloration with the skin. And that lack of good vascular supply for the nerve causes the nerve to start deteriorating. Nerves are very, very, what's the word I'm looking for? They're in need of a tremendous amount of oxygen and nutrients.
So are you improving circulation with what you're doing? Is that one way to look at it?
That does happen as you bring the nerve back to life. But the actual goal of the treatment is directed specifically at the nerve itself.
Okay.
It's about bringing the nerve back to a place where it conducts electrically the way that it should.
So it's an electrical problem? Is that how you look at it?
That's exactly what it is.
Okay. Yeah. So help me understand. Okay. So peripheral neuropathy in the world of pain management, things like that. I mean, these pain management centers are dealing with this a lot. This is a big problem. So how is it normally treated? nationally, and how do you differ in the standard treatment?
Okay, typically this is what these patients come in and have for a history. As we start asking them what they've gone through, the symptoms started, generally with the tingling or pins and needles kind of a feeling, and have progressed through. They go to their physician, they get put on medications that help with the symptoms. The Neurontins, Lyricas, medications like that, which are very effective at really essentially numbing down the central nervous system's perception of that pain. Oftentimes antidepressants, for example, will get prescribed for these patients as well.
So those pain medications obviously come along with their own set of side effects.
Well, yeah, as all drugs do, right?
Now, do you not, and I know you want to be positive here, but you don't like that approach, that first line therapy?
I don't like any approach that doesn't deal with the underlying causative factors.
You think it's just suppressing symptoms?
Yeah, and I don't think anyone would disagree with that. Okay. I mean, when the patient goes into their physician with this problem, I don't think any other doctors are telling them, I'm going to give you this drug to fix the problem. They're having a very frank discussion with their patients and saying, look, we're going to use these drugs to suppress the symptoms so that you can at least live with the problem. And they work
for the most part?
They do work for these patients in large part. I mean, some people they don't work at all for.
Then what's the next level? Okay, so it starts with these minor problems. If the drugs don't work, what's the next course of action? Just increasing the drugs?
Yeah, the medication doses go up. The problem is the side effects with these drugs can be pretty dramatic for some of these patients. They start developing early dementia, for example, ataxia, where they have problems with balance, early Alzheimer's type symptoms. So these medications are not something that, doctors want patients on long-term if they don't have to be, and patients don't want to be on them long-term either.
Okay. Do you have people that you're able to wean off the medications?
Yeah.
Is that happening?
I mean, ultimately the patients only take the medication because of the pain associated with the condition.
Okay.
And so if you can get that under control, they have no reason anymore to need to take these medications.
And that's happening. I mean, you see that happening?
Regularly.
What should every patient that has this problem, peripheral neuropathy, what do they need to know about their disease, about their problem, and about what can be done?
They need to know that, one, it's not necessarily a life sentence. They don't have to just live with it for the rest of their lives. But they also need to know that they're going to have to probably make some changes in their life, because it's not enough to just treat the issue and get it back if there's underlying issues that have caused it in the first place. For example,
what?
Well, if you're a diabetic, for example, and it's being caused by your diabetes being out of control, we're going to need to do something to address that, because that's the underlying metabolic reason.
And in your center, you say type 2 diabetes is almost always reversible. Is that right?
In the vast majority of cases,
so when
that's
you take care of the diabetes, do you see that this neuropathy goes away as well?
Not always, and that's why treating the neuropathy itself as its own entity to some extent is many times important. Just treating their diabetes will take care of the underlying metabolic driver that's causing the problem, but it won't necessarily cause the nerve to come back to life, so to speak, for the patient.
So that's what you're doing. I mean, is it like you're regenerating the nerve?
Well, the nerve itself, in most cases...
Well, you're using electrical, I guess, electrical treatment.
Right.
Neuroelectrical, what do you call it?
Call it neuroelectrical therapy. It really is... Look, the human nervous system is essentially a big electrical system, right, that conducts electrical messages. And so, because it's an electrical problem, it needs to have an electrical solution, in our opinion. And when these nerves are damaged, so to speak, it's not like physical damage where they've been severed or a chunk's been taken out of them. What's happened in most of these cases is that the nerves have been starved of the things that they need to function, and they go into a protective mode.
And that protective mode causes what? The shooting pain? The tingling, the numbness?
It causes all of the above.
Okay.
And it's progressive. So usually it starts off, like I said, with the tingling and the numbness, and it eventually ends up with the burning and the pain, and then finally it ends up in numbness again and loss of motor function.
So tingling and numbness is usually where it starts, and then it moves into the pain.
Generally, that's the course.
But is it tough to get people in on the tingling and the numbness? Do they usually wait until the pain comes?
Yeah, unfortunately, that's the case. But some patients do take action right away. I would tell patients out there who have the early signs, don't wait until it gets there.
So somebody watching this, let's talk about early signs for just a moment.
Yeah.
Those early signs are?
Well, you just nailed them: the pins and needles and the numbness.
When you say pins and needles, like light, faint?
Yeah, almost like when people hit their funny bone. You know that sensation you have when
it comes and goes here and there, like throughout the day.
It can be transient, and eventually, of course, it becomes more and more constant. But the key is with these things is there's usually other lifestyle issues that start being impacted, like balance, for example. If you can't feel your feet very well, it becomes pretty difficult to walk with any kind of, real solid foundation under you. So how does that bleed into all other aspects of life? Now you have the patient who's stuck at home because they don't want to go out for fear of, not feeling something and falling.
Okay.
So their lives get impacted very significantly. They have huge changes that happen in their life as a result of this problem. It's not just my feet hurt. It's my feet hurt and I'm missing out on all these different aspects of life. I can't sleep anymore at night because putting covers over my feet kills me.
Really?
I can't put a pair of shoes on.
It hurts to put covers on and things.
Yeah, I mean, some of these patients literally you can't touch the skin on their feet or on their hands because it's that painful. They walk around, they have to walk around barefoot or in like slippers all the time because putting anything on that has any kind of pressure causes discomfort for them.
Now, not a lot of centers have this technology. Were you skeptical when you first heard about it?
I was.
What due diligence did you do?
Yeah.
And how happy are you with it?
Well, I was skeptical. I wasn't, conceptually it made sense to me, but proof's always in the pudding. I wanted to see the results.
So are you surprised with the results?
I am somewhat surprised at how fast the results happen.
Really?
I expected once I understood how the technology worked and how to apply it and everything involved in the proper therapeutic approach, it made sense to me that it would work, but it was hard for me to believe how fast it would work for these people.
Okay.
Many of these patients are seeing dramatic changes in their neuropathy in a matter of a few visits.
So take me through that process. Like, what do they say? What do they do? Like, give me maybe a dramatic turnaround that you've seen or a reversal you've seen.
Okay. Great example. Gentleman about 65 years old, diabetic, by the way, taking statin drugs, which were part of the issue in his case.
Okay.
Neuropathy in both hands, was unable really to do those fine motor skills that you need to be able to feel your fingertips for.
All right.
So we've been treating him actually as a diabetic, had neuropathy as well. His diabetes dramatically improved, but his neuropathy was still there. And so we put him through this treatment approach. We said, all right, here's what we're going to do. Explained it to him, made sense to him, went through the approach. 3 weeks into treatment, he can feel his hands again, like back to normal, all the way back to normal.
Really?
As though he never had the problem before. And so this is the kind of stuff that's possible when you really get the nerve retrained, essentially. I mean, that's basically what the technology does.
Kind of a jolt of electricity in a way? Am I understanding it correctly?
No, it's not a jolt. What it is it's a continuous therapy that lasts for about 30 minutes in most therapeutic settings. And what it does, it's putting a current through the nerve that is greater than what the normal current would be that the body produces, which allows these nerves that have essentially shrunk. Look, you got to understand what happens to the nerves when they're damaged, so to speak. What happens when they're starved of oxygen is the nerves literally shrink in length.
Okay.
When they shrink in length, it creates a larger gap from one nerve to the next.
Okay.
When an electrical impulse comes down a nerve, it has to be great enough to bridge over that gap to fire the next nerve to keep the signal going. So when the oxygen is starved from the nerve, or when the nutrients are starved from being inside of that gap that conduct that thing across it, what happens is now a message comes down. It's not great enough to jump the gap, so it just stops right there. What this therapy does is it rebuilds that by putting a greater current through. By every time that gap is jumped, it brings nutrients back to it and starts to close the gap over time.
Interesting. I mean, could you prove any of this? I mean, can you show them a printout?
There's no printout that comes out off the machine, but the literature is very clear on this, that this is what happens when nerves are affected, and that this therapy very, very clearly does exactly what we're talking about. But the proof's really in the pudding. I mean, I'll be honest with you. These patients could care less about getting a piece of paper that tells them that, this is what it's doing and this is what things looked like before. All they care about is my feet were on fire before and now I have no pain.
Have you had them say that? I mean, that exact expression?
Yeah.
My feet were on fire before and now they're not?
Right. Yeah, great. Here's a great example.
This is common, by the way, because I mean, obviously I don't hear about it. People probably with these problems don't go around telling everybody other than their doctor.
Well, you don't see them much because they stay home a lot.
But this is a common issue?
It's a real common issue.
Okay.
Especially as people get a little older, it becomes a real common issue. If you're a diabetic, it's, it's on the forefront of most of their minds. Knowing
Are they
that
being
it's something
told,
coming down.
hey, just live with it? It's part of your type 2 diabetes. You're going to have a little bit of neuropathy.
Right. It's going to develop eventually. I mean, that's
but you don't buy
essentially. No, I don't buy that at all.
Okay.
Well, I mean, I don't buy that their diabetes has to just keep moving along either. So it becomes pretty simple to know that neither does the neuropathy. It doesn't have to just be that way. And just because you have it now doesn't mean you have to have it forever.
So these patients that come in, they're pain patients, or maybe they're miserable, and they've been around. I mean, they've been to multiple doctors. Mm-hmm. What are their questions? What do they want to know? What do they ask?
Well, they want to understand the treatment approach, which we explain. Our treatment approach with patients is always identify the underlying causes. So what are the triggers for the actual issue? Eliminate those triggers, and then support the body. And that we use that same approach with this. So those are they want to know, how does it work? What is it exactly that's going to be done? And we explain that. We explain to them, here's in your case why this developed. If it's a patient who's come into us post-cancer treatment and their chemotherapeutic agents that were necessary to save their life over here, but caused damage on this end.
Okay.
Well, those patients, we're going to explain to them, here's how that happened. Here's the why.
So
here's the treatment.
Considered alternative medicine, integrative medicine? I mean, what do you call it?
We call everything we do integrative, but that's because of the setting that we work in,
because I know you have a medical doctor and things like that.
Yeah, because we have physicians from all different backgrounds. We always work in an integrative approach, but nothing about what we're talking about is alternative. This isn't, there's nothing weird about it. It's very straightforward, using technology to our advantage. We live in the 21st century here.
What could an expert poo-poo this? I mean, what could they say negative about this? About this electrical therapy for neuropathy? What could they say?
I suppose they could say that it doesn't work, that it's it's quackery or quack science, or but And
what do you say to that? Look into it. Take a closer look.
I'd say do the research.
Okay.
I'd say talk to their patients who've been through the treatment. I mean, look,
because doctors will watch this show.
Sure, and the literature on it is pretty clear. That it works, and the science behind it is logical and makes sense. And I think anyone that reads it will see that it does make sense. But more important than all of that, I mean, we all, as physicians, we all love to read research and see that things prove themselves out in laboratories, so to speak. But nothing's more proof than the patient who's in front of you that you've been treating for 3 years for their neuropathy, prescribing the medications to, who's complaining all the time, who comes into you and says, hey, my neuropathy's gone. Right? I mean, you can't argue.
Are you ever surprised? I think maybe I've asked you that, but I mean, are you surprised sometimes?
Yeah, I'm just
the way it's working.
I'm surprised at how quickly it's working.
So neuroelectrotherapy, but you said, and we've talked off camera, that couldn't do it alone. That
correct.
The right kind of nutrition, anti-inflammatory diet. You put them on supplements, but you do some serious testing. Let's talk about the testing and how it plays a role working together.
Right.
With this therapy.
Again, in our approach, we always deal with address the underlying cause, right? So identify the trigger. Well, that's where testing comes in. We need to understand.
So you're doing blood work on looking for what?
We're looking for inflammatory markers. We're looking for things like, are they an undiagnosed diabetic possibly?
Okay.
We're looking for markers that tell us that we've got lipid problems, for example, and we might have vascular issues as a result of that, plaquing in the arteries that are feeding nerves. So we want to look at all of these things, because these are the underlying causative factors in many of these cases. And if that stuff's there, we've got to address that. Because even if we could get the nerve back to a place where it functions well over the course of, say, 4 to 5 weeks, and the patient now feels better, if they have all the underlying stuff that drove them there in the first place, they're just going to end up with it again. And, we're not really all that interested in giving patients, quick results that don't last. We've talked about this at length, and I think every time we've talked, and our center is about results and not temporary results. We want to give them results that last.
And you're doing things like, but other things you're doing, I mean, you're looking at their nutrient profiles, you're looking at food allergies.
Yep.
All play a role here.
Yeah.
In this nerve problem, in this electrical problem.
They can. They don't always play a role, but they can play a role. If a patient is continually eating things that are driving, for example, the inflammatory process in their system, well, inflammation doesn't really help a whole lot in these kinds of scenarios. Okay. We got to control that inflammatory process. And, there's 2 ways to control an inflammatory process. Give the body synthetics to suppress it, or take away the offending thing in the first place that's causing it.
So do you think, so you're healing? Are you healing this problem rather than just suppressing the symptoms?
Yeah, we give the body the tools and the building blocks that it needs so that it can actually heal and regenerate itself. So that things get back to a normal, foundation, and where the body can really function the way that it was intended to in the first place.
You talked about diminished. I mean, have you seen 100% where it's gone?
Yes, we have.
Really?
We have. It's as common for that as it is for the person to have it diminish and maybe it doesn't go all the way away. The body does have limited recuperative abilities, right? I mean, you can damage tissue enough that it can't be fixed all the way.
Okay.
We all agree that that's possible. And it's no different in this scenario. So there are people who get better, but not all the way. And there are people who get all the way better. And, unfortunately, it's not always easy to predict which one of those categories a patient will fit into. But patients always get improvement.
Okay.
And that's the great news.
And so that's multiple treatments, and they come in once a week, a couple times a week, maybe? Is that right?
Yeah, usually a few times a week initially.
Do they feel better after their first treatment ever?
Yes.
Okay.
Yeah. That's pretty common, actually. So now it doesn't necessarily last for a real long time after their first treatment.
But they can walk in pain.
Yeah.
And they leave going, oh my goodness.
And leave with a tremendously lower pain.
How do you explain that then? How do you explain that?
It's simple. It's endorphins, right?
Okay.
The therapy actually will stimulate the body to release its own endorphins. So there's not only a regenerative component to the treatment, there's also a pain mediation component to it. So the body does increase its endorphin response, and those endorphins are our natural painkillers. So patients walk out generally with a pretty significantly diminished pain threshold.
Okay, it seems very simple. I mean, you're retraining the nerves. In brain science, I guess they call it plasticity, where the brain can learn or improve or things like that.
Right.
Same kind of thing here, right?
Yeah, and it's less complicated here, to be honest with you, than that is. I mean, we're not even dealing with. We're just dealing with.
So you're stimulating the nerve. And the nerve gets better.
Exactly.
It learns how to work the way it used to work.
Exactly.
When you say it
learns to take the same. It learns to take the same paths that it used to work properly, as opposed to getting to a point where it stops and dissipates.
Is it being pinched by something, or is it being what?
Sometimes it is. I mean, there can be mechanical causes. So sciatica is a great example of that. Sciatica generally caused by a lumbar disc problem, right, where the disc is actually mechanically impinging on the nerve.
Okay.
But that's not all neuropathies. Some neuropathies are just this sort of starvation syndrome. They're not getting the nutrients and the oxygen they need to function properly. So this is where it comes down to a good case history, a good exam, and doing the background work to figure out the cause, right? Because look, if I treat you nutritionally and the problem is a disc problem, what good is that going to do you? If that's not the cause, what do I need to treat you with that for? We got to address the cause. And so identifying the cause for the individual patient is the key to this getting better for them.
So everybody's going to get a little bit different treatment. And you use multi-modalities. I mean, a lot of different, you're aggressive with this. Is that correct?
Yeah.
I mean, you mentioned some of the things, vibrations and lasers, possibly a lot of different type of things you're using.
Whatever tools are necessary is the answer.
We're going to take a quick break. We come back. I have questions about insurance. If insurance covers this. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about new breakthroughs, new treatment options for people with peripheral neuropathy. Okay, so a recap of the symptoms of who would benefit from this approach, this neuroelectrical
numbness,
okay,
tingling, feeling that you have ants or spiders crawling on your skin, burning.
And this is for the extremities we're talking about.
Okay. Hands, feet, legs, and arms. Balance issues, because you can't feel your feet, for example. Those are great candidates. Those are the patients whose lives are really being impacted by those symptoms. And these are the people that need to be.
Does insurance cover any of this?
Yes.
And can cover this? I mean, most insurances, Medicare?
Yes.
Covers this?
Yeah.
Now, of course, I know you're doing supplements, things like that, so the insurance doesn't cover that, but...
Yeah, no insurance ever covers every aspect of a patient's care, right? We're long past those days.
But this neuroelectrical stimulation is covered by
absolutely.
Insurance. Yeah, sounds like... it's worth a try. I mean, if people are watching this, we always say, on my show secretly, our goal is that people learn something, that, people need to know this is a real interview. I mean, this is not staged in the way. I mean, I basically have met you today. But how could they learn more? Okay, so we're out of time. Somebody watching this. Where do they learn more? Call. You guys have for free consultations.
Right. Go to our website. You can get more information there. But, you know, the best way to learn more always is to let us do our job as doctors, which is to teach. And the best way to do that is in a one-on-one setting where we can sit down with you, understand your problem, and then advise as to what we think the best approach is.
So potentially some people aren't candidates.
Yeah.
And you'll let them know.
Absolutely. Yeah, we have patients that come into our office for any number of those conditions that we treat on a regular basis who aren't good candidates, and we let them know that.
Okay, good. Well, I want to thank you so much for coming on the show.
Thank you.
And I guess it begins with the consultation, and I guess they could visit our website. We'll post this interview on our website as well. So you've been watching The Wellness Hour, the leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again or share this interview with a friend, you can visit our website at wellnesshour.com. Just put in Dr. Ott's name. That should be an easy one, OTT, or you could put in peripheral neuropathy. If you could spell that, we'll find that there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.